Hi, I'm Dr. Hillary from Rangeline Chiropractic. One thing that I've been talking to my patients a lot lately is about shoulders injuries, even like restrictions in the shoulder, such as frozen shoulder syndrome, and the causes, and then how we're going to fix it. But one thing I always come back to time and time again are a couple stretches for the shoulder that I think everyone could do. So if you are suffering with some kind of shoulder ailment, let's say, and you're not sure what to do, I have a couple of stretches I think that would be good for everyone to do. And you can also try them to see if you are able to do it. So one thing is called a wall angel. Let's pretend I'm standing against this wall. Your arms are down, so the backs of my hands are on the wall. And then you bring it up. The whole time, the back of your hand and arm is against the wall, okay? You're bringing it up the whole time, and then what you're trying to do is to see if you can get them perfectly straight, symmetrically, but then also keeping it against the wall. So if you have to like twist to get it up there, then you can't do it. Then start back. And then what you can notice over time is that you can get higher and higher. And you can also see if like one shoulder has a better range of motion than the other. And you're like, I get to here and it's painful. Well, don't push it, but every day just kind of work up. Pick a spot on the wall and work up and see how far you can get up on your wall angel. That being said, sometimes the shoulder joint feels kind of jammed in there, and no matter what you're doing against the stretching and the wall angels, it can be jammed in there. So what I suggest doing is taking a weight. So let's pretend my coffee cup's a weight. Hold it with the shoulder, kind of bend over if you need to, and then just gently, I'm just going to make circles within the joint. It opens up this joint right through here. I'm not trying to force anything. It's just a gentle movement. You go clockwise, counterclockwise, but it's not something that you're putting muscle into to do it. It's just a gentle pull of this joint. So maybe like a couple pounds. And if a couple pounds is too much, then just do it with your arm weight. But things like that, just doing that every day, that can really help your shoulder. Shoulders go out of alignment just like your spine does, and that's something that we do at our office is we work on the shoulder joints, getting them lined up, and then we work a lot on the muscles like the rotator cuff, because when they get tight, it restricts your motion. We can do things after the adjustment such as dry needling to help with that. We have laser therapy when there's a lot of inflammation and swelling. Kinesio tape is great to help tape up the shoulder to give it some stability. Cupping with these muscles in the back and on the shoulder. We have so many things that we can do at the office that can help with shoulders and prevent them from becoming like a big problem and prevent an unnecessary surgery perhaps. So reach out if you have any questions.